Hello and welcome. So, you're starting to think about fertility testing, and you're in exactly the right place. I know it can feel like this huge, maybe even kind of scary first step, but that's what this is all for. We're going to make this feel simple, clear, and way more manageable. Let's get started. Okay, let's kick things off with this because it's really the whole mindset we need. The point of all this testing isn't to pile on more stress. It's the exact opposite. It's all about getting clear information that empowers you, helps you understand your own body, and lets you make the best decisions moving forward. And look, before we dive into any of the details, I just have to say this. It is 100% normal to feel anxious about all of this. Seriously, you are so not alone in that feeling. So today, our one and only goal is to pull back the curtain on each step so you can walk away feeling ready for what's next. So where do we begin? Well, let's start by just setting the stage and getting a handle on the basics before you even step foot in a clinic. You'll probably see this official-sounding definition on some paperwork or hear it from your doctor. And yeah, clinically, it's the guideline. But what's way more important is understanding what it means for you and your own personal timeline. Here's the key. Don't get bogged down by the clinical definition. It's really just a medical guideline that opens the door for an evaluation. Just think of it as the starting point for a really productive conversation with your doctor, not some kind of label. In fact, that 12-month rule, it is definitely not set in stone. A lot of the time, this conversation starts way sooner. For women over 35, the guideline is usually more like 6 months. And if you're over 40 or you already know you have irregular cycles, it can start right away. And of course, if you're planning for fertility preservation, there's absolutely no reason to wait.
All right, let's get into the first active step you're probably going to take. And the great news is it's super straightforward. It's a simple blood draw to get a really clear snapshot of your key reproductive hormones.
So this blood work is mostly looking at two main hormones, AMH and FSH. Let's use a little warehouse analogy to make this easy. Think of AMH as your egg inventory. It gives us an idea of your remaining egg supply. And then there's FSH, who's kind of like the manager. It tells us how hard your body is working to get one of those eggs ready each month. So let's zoom in on AMH, or anti-Mullerian hormone. This is what doctors call your ovarian reserve. A lower number might mean a lower egg count, and a higher one could mean a more robust reserve. It's just a really important piece of the puzzle. And honestly, one of the best things about this particular test is that you can get it done on any day of your menstrual cycle. Super convenient.
Okay, next up is FSH, or follicle stimulating hormone. This is our manager. If your FSH level comes back a little high, it just means your brain is having to work a little harder, sending a stronger signal to get your ovaries to ovulate. It's like turning up the volume to make sure the message gets through. Now with this one, timing is everything. It has to be done on or around day 3 of your cycle to be accurate.
All right, so we've got the hormonal picture from your blood work. The next logical step is to actually get a visual of what's going on inside. And that brings us to the baseline ultrasound. Your first imaging test is likely going to be a transvaginal ultrasound. And I really want to stress that this is a quick, super routine, and for almost everyone, a painless procedure. It gives an incredibly clear view of your uterus and ovaries, and the whole thing is usually done in just 15 to 30 minutes. So what should you expect? It's pretty simple. You'll lie back on an exam table, just like you would for a pap smear. A thin, lubricated wand, called a transducer, is gently inserted. The technician then moves it around to get pictures, looking at the structure of your uterus and ovaries. They'll also often do what's called an antral follicle count, basically counting the little resting follicles, which gives us yet another clue about your ovarian reserve. Okay, so that baseline ultrasound gives us a great starting point, a really good snapshot. But to see how things actually change and work throughout your cycle in real time, we turn to something called follicular scans. So a follicular scan isn't a one-and-done kind of thing. It's actually a series of ultrasounds. The whole point is to track the growth of the follicles in your ovaries, watching as one of them becomes the dominant one. This lets your doctor see not just that your body is trying to ovulate, but how it's happening, and it lets them predict the timing with amazing accuracy. And this is where you can see how useful these scans really are. By pinpointing ovulation so precisely, they help time everything perfectly, whether that's for timing intercourse at home, a procedure like IUI, or for closely monitoring how your body's responding to medications during an IVF cycle. It really is all about precision. So what does this actually look like on a calendar? Well, it all starts with that baseline scan back on day 2 or 3 of your cycle. And remember, day 1 is the first day of your period. Then you'll come back for a few more scans somewhere between days 9 and 16 to watch how those follicles in your uterine lining are developing. Once a dominant follicle gets to the right size, ovulation is right around the corner. They might even do one final scan after to confirm that the egg was successfully released. Okay, we've covered a lot of ground here, from hormones to imaging. Now let's put all of these pieces together and see how they create your first complete and incredibly valuable fertility snapshot. This is a perfect summary. Your hormone tests, that's your static data. It tells you about the inventory and how hard the manager is working. Then the baseline ultrasound checks out the fundamental health and structure of everything. And finally, the follicular scans give you that crucial, real-time data, showing if and how well your body is actually ovulating. And here's the most important part. These tests don't exist in a vacuum. When you combine all of them, you're no longer in the dark. You're now armed with a powerful starting point for a clear, focused, and really productive conversation with your doctor about what comes next. And that brings us to the end. We've walked through the first steps of fertility testing and hopefully turned some unknowns into a clear, manageable process. So I'll just leave you with this thought. Now that you have this knowledge, what questions are you going to ask to take control of your fertility journey?